Pediatric transplant is a very specialized field, one that started and is based in Pittsburgh. There's an effort to bring that care closer to you. That's the topic of today's Bridging the Great Health Divide. There are approximately 600 pediatric liver transplants performed in the United States every year. Nearly 40 of those are performed by the doctors at UPMC Children's Hospital of Pittsburgh.
Everyone here is child-focused, and it's a very different feel than, say, a hospital that, does pediatric transplant on the side. It's more of a family thing.
Dr. Kyle Soltis says families are a vital part of the decision-making process.
Families are really part of the transplant team. I think that's very different than elsewhere where, many of the times the families come to us and say, hey, this is going on. And, I think that this, and usually they're right. We understand that they're such an important part of the team. That's really one huge difference, I think, and one thing that sets children's apart.
Soltis says that working relationship leads to a closer bond between doctor and patient.
You also get to follow these kids from the time they're born. And so, these patients that you've been following and you've been getting the pictures and talking to the families, and you see them every year and you go to camp with them and do all these things with them, you do have a very different emotional attachment to them than I think most doctors have with their patients.
With access to specialized care hard to come by in the region, Soltis says that UPMC Children's Hospital is making the effort to reach more transplant patients through localized clinics.
We realize that there's a lot of difficulty in patients getting to us. We've tried to maximize the number of places that we go to offer specialty services, because there's smaller clinics that are devoted to these patients. It's a great way to actually increase the amount of times that we can steer their care and try to, not bring them all the way to Pittsburgh, but still, get them into a situation where they can be treated.
The outreach also includes performing procedures outside of the Pittsburgh area.
The idea that our team goes to other hospitals is almost unheard of. In fact, it's never been done, and we're expanding even further, hopefully. So the number of places that we can actually physically go and do these very complex procedures and care for the children, just like they're in Pittsburgh, I think that's something that's very different and kind of sets us apart.
To learn more about pediatric transplant at UPMC Children's Hospital of Pittsburgh, call 412-692-6110.